spreading the word about Ebola on the outskirts of Kinshasa. Bob Misima has been on the front lines of the fight against infectious diseases in the DRC for more than a decade. Although the capital city has not recorded any Ebola cases, Misima and his colleagues are raising awareness about the virus here, especially as people are still crowding into churches, music concerts, and social events.
We are afraid because if Ebola reaches Kinshasa, it could spread quickly given our people's mentality. People here love music, hugging and greeting each other warmly. That is why we are informing them now so they know how to protect themselves and keep safe distance from infected people.
The main laboratory in Kinshasa is supporting teams in other parts of the DRC to test suspected cases of the rare Bundibugyo strain, which has been spreading in Ituri province since last month. A few years ago, samples from every suspected Ebola case across the DRC had to be brought here for testing. The delays meant the virus continued spreading in communities as authorities waited for results. But the National Institute for Biomedical Research has now set up mobile labs to speed up the process. More tests are now being conducted in the Ebola hotspots.
Most samples from the outbreak area, from the eastern part, are analyzed on site. For the Ituri province, there is a provincial lab which is there, where our mobile laboratory is located, so all the samples are analyzed there. And in the North Kivu and South Kivu, they're analyzed in Goma.
But this Ebola outbreak is more than a health crisis. Some people are questioning whether the virus exists.
Community engagement is a key point. The population continue to say that it is not Ebola. They don't believe that it is Ebola. And that is dangerous.
The Africa Centers for Disease Control and Prevention recently warned the outbreak in the DRC could become the worst to date if weaknesses in the response are not addressed quickly. Donors have pledged more than $900 million to support Ebola response efforts in the DRC, but less than 10% of those funds have been released so far. That has left authorities and aid agencies struggling to curb the spread of the disease with their limited resources. Chris Ochamringa, Al Jazeera, Kinshasa, DRC.